Potassium. Normal level of potassium is 3.5 to 5.0 milliequivalents per liter. Potassium is an electrolyte that plays a critical role in nerve impulses, muscle contraction, and cardiac function. It's also important to note that, generally, as sodium increases, potassium decreases, and as sodium decreases, potassium increases. Hypokalemia. Hypokalemia is a condition in which the potassium level is less than 3.5 milliequivalents per liter. Causes for hypokalemia include GI loss, such as diarrhea, NG, suctioning, laxative abuse, vomiting, ileostomy drainage, and magnesium deficiency. Renal loss, such as diuretics and increased aldosterone, prolonged NPO status, insulin shortage, a low potassium diet, and metabolic alkalosis. Signs and symptoms of hypokalemia include fatigue, nausea and vomiting, weak or irregular pulse, flat T waves, digitalis toxicity, muscle weakness, decreased GI mobility or paralytic ileus, paresthesia, decreased reflexes, possible U waves, dysrhythmias, respiratory distress, and hyperglycemia. Begin by treating the underlying cause. Also, give potassium supplements, either PO or IV. Be sure to have Kxalate on hand and that the patient has a urine output of at least 0.5 milliliters per kilogram. As a nurse, it's important to assess vital signs, bowel sounds, appetite, muscle strength, deep tendon reflexes, intake and output, cardiac monitoring, and to teach the patient about their condition. Hyperkalemia. Hyperkalemia is a condition that occurs when the potassium level is greater than 5.0 milliequivalents per liter. Causes include an impaired excretion of potassium, the movement of intracellular fluid to extracellular fluid, excessive potassium intake, burns, ACE inhibitors, and malfunctioning adrenal glands. Signs and symptoms of hyperkalemia include cellular hyperexcitability, irritability, anxiety, leg pain and leg cramping, followed by muscle weakness and eventual paralysis, GI cramping, diarrhea, slowed, depolarized, and quickened repolarization of cardiac tissue, flat T waves, and tall and peaked T waves. Begin by treating the underlying cause. Continue placing the patient on ECG monitoring. Restrict dietary intake of potassium. Remove offending IV fluids. Administer Kxalate PO or rectally. Use IV insulin and glucose in case of diabetes. You can also use sodium bicarbonate and IV calcium gluconate. Hemodialysis can be used in cases caused by renal failure.